Hello guys, this is Dr. Asif Nawaz. How are you? There is a lot of time I have been passed of making or I have a gap of making videos. So thank you very much. I'm back. So a few of my subscribers as well as my viewers some text me about making trauma. Okay, so trauma, I think it was not so tough but diplomatic. But as you see that the lub belly or bellies and lubs has its own trauma chapters like part 4 and 5. So one is a systemic or elective orthopedics, one and another one was trauma. So as you know that trauma you have to face the trauma patient all over your life. So wherever you works for, or if you are doctors, so there is a possibility to face any trauma patient of any hospitals. If you are working on the outdoor patient or outpatient department as well as field hospital or ward zone or the WHO services or others in the conflict area, so you have to face a lot of trauma patients. So today I'm going to discuss about the trauma and the trauma induced trauma related or induced or trauma related managements and the assessment. Okay, so as you see, this is the belly and lub trauma chapters part 4. So there are several other chapters regarding the trauma, but in this video we will discuss first two: introduction of trauma and an early assessment and management of severe trauma. Okay, so let's discuss it. First, it is a vast chapters, but we will make it short. Okay, we will discuss the magnetic portion or the main portions. Okay, so first the definitions of trauma. Trauma originates from the Greek word that is own. Trauma means the own. Okay, and it implies the physical forces exerted on a person has led to a physical injury. So the wound or any cut injury or any kind of injury that is happened due to external cause, like road traffic accident, like ward trauma, like fall from height, or any accidental injuries, or any fighting injuries. Okay, like a violent criminal act. So sometimes this kind of wound can be originated or happen. So this is the wound, means the wound it happens, the physical force exerted on a person has led to physical injury. Now the external energy forms the force that can lead to injury, including the chemical, thermal. So what kind of injury can be occurs? That is chemical, thermal, ionizing radiations, and the most frequently those who are the mechanical origin. So there must be a definitive cause of trauma wound. Okay, so these wound can be happen by this way: chemical, thermal, ionizing radiations, and also. So now in the major trauma denotes injuries to more than one body, region, and organ. So the trauma can be occurs in more than one body, and in next group chapters the trauma will be examined at a variety of viewpoints and the different specialists. So later on it will be discussed. So these three lines is important in this part. So okay, just focusing in these lines and underline this and read it again and again. In that case you will have a great or a good control over your trauma chapters. So magnitude of the problem. So first and foremost is you must to identify or assess the magnitude of the problem. So here you can see the trauma remains the most common cause of the death, the disability in the children, young adults in resource rich countries. So here you can see the resource rich countries has the many occurrence of death and disability in the children and young adults, especially in these groups, are suffering from the trauma, or the patient from the children and young adults are very much suffer with the trauma. So these are the global statistics. But road traffic accident, fall, intentionally violent, the major factors in the traumatic injury. So road traffic accident is so much common in trauma patients, among these trauma patients. So these are the different statistical analysis here in different countries. So it is not important for any PG exams, because if you have any interest about the global trauma care or the trauma management, you can read thoroughly here, but it is not so much important. So here you can see the number of the road death per million inhabitants. So it is increasing day by day. Okay, so provisional faculty marks the road outline 15 deaths. Okay, no need. We don't need this kind of things. Is all our statistical related data. Okay. So in general, the vast majority of the injuries sustained are not limb threatening or life threatening. So it is a message that trauma, if a patient is in trauma, so it is not necessary that it will be deadly or fatal. Sometimes it is a minor injury that is also regarded as a trauma. Okay, so it is not always a limb threatening or the life threatening. A simple or minor trauma can be, minor injury can be happened in the trauma patient. Okay. So some patients are straightforward and most patients are expected to fully recovery and return to their pre-injury state. Okay, it is a statement. We must be vigilant not to miss non-accidental injuries. Okay, and the injuries and other groups related to underlying causes. 66% not off note. It has been shown that 66% cases when the children are assisted abuse has some previous interaction of the health professional or social service, but seriousness of situation not fully appreciated. Okay, so this is the statistical analysis. Now the management of trauma. So just focus here as a summary box, because the most of the summary boxes of Bailey's and Lups is so much important, because it is in short, like this four part is important. Here the vast majority injuries are not life threatening but limb threatening, that I already said. Severe trauma countries to be major cause of death, because I already told the resource rich countries, so much they are so much suffering from this kind of trauma, that is children and young adults are most often or commonly affected, and older patients have fragility fracture opens additional burden of the healthcare system, because old people has less bone density and more chances of osteoporosis and other bone diseases, so they are more prone to fracture. So in the elderly age, these elder patients are suffering from fragility of the bones, so that there has more possibility of fracture, or there is a huge possibility of fractures or fracture patient, and that is non-healing characteristics. Some are non-healing in character. So the healthcare system has this kind of burden with these patients, and they look for the important features of injury that could influence the outcome. So you have to find out the possibilities of injuries, and as well as you have to make a plan for management the specific injuries. Okay, now the management of the trauma. Here the significance of time of the outcome. Now when a patient came to you, so the time evaluation is very important, because the more you go being late, the more damage you have to encounter. That means if you diagnose early, or if you diagnose the sites and the possibilities as early as possible, because if you diagnose this in early, in that case the management will be is easier than the late one. Here you can see the two figures here. Look at the figures. That is airway obstruction. It has a limited time limit, so you have to identify as early as possible that it is a patient of air obstruction, because there is a chances of hypoxia, there is a chance of 4 minutes, although 4 to 5 minutes you only have to manage the air obstruction. Now if the patient has a blunt trauma abdomen or any this kind of injury, so you have the intra-abdominal bleeding, there is a possibility chance of intra-abdominal bleeding, so it has a extended time limit, so you have sometimes more than the airway obstruction. Now the extradural hematoma, so extradural hematoma has a huge time extent, so you have much time to diagnose the extradural hematoma, and as well as you can manage for surgical extraction sometimes, and some hematoma may need not to have any surgery. Now the ischemic limit. So ischemia, that means it has the largest time limit, and ischemic limb means the limbs, okay, it has some times for saving any limb. So if there is a limb trauma or other extremity trauma, so you have some time limit, or you have adequate time to manage that trauma. Now the diagrammatic representation of relationship between the assessment and response of times. So assessment time, first you have some assessment time and the response time, okay, and overall time of generic injury. So here a patient come from hospital in this 0 limit, and this is a death. So this is a huge time. So in this time limit you have to manage that patient, and if I make this 2 time, I divide this time limit into 2 sections. So one is assessment time, another one is a response time, okay. So first we have to assess the patient. Now we will make the management. If we fail that, then death is inevitable sometimes. Okay, so here another one I am going to discuss, that is ATLS, that is Advanced Trauma Life Support. It is a protocol or principles that must be followed. So there are some key points or the key components of ATLS. So system, that is ABCD, there is 4 specimen, that is airway, breathing, circulation and disability limitations. So ABCD means there are 4 components: airway, breathing, circulation and disability. So the properties instituted upon the time dependence, the clinician should bear in mind that a successful management plan is dependent on the first time intended to evaluate and diagnose the nature of the problem, and the second time taken response effectively, condition resolved. Okay, so a clinician must obey that ABCD because it brings the successful management plan as well as good diagnosis and evaluate and treatment. Okay, so another one is the Glasgow Coma scale. Okay, so when we manage that ATLS, so we will assess the GCS, that is patient following road traffic accident with the scalp laceration, reduced GCS. So GCS scoring system is very important for assessing head injury or head injury related patient has some parameters of extent of injury, that by which you can assess the extent of injury, or you can assess the damage of how long or how extended the damage of the brain is. So the more the drop the GCS, the less chances of curing, or the less chances of good outcome. So here you can see some test, that is CT, the computed tomography, sometimes administered to identify where is the damage or deterioration occurs due to road traffic accident or others. Sometimes that depends early diagnosis. So what is the importance of time? In short, we can see the time concept is essential component of trauma management. Assessment should be completed within a set time, and the time is limited. That means you have limited time to respond. So you have to make the diagnosis and adequate management. And the both assessment and the response should take place in the time window period irreversible damage of the tooth. So you can see this, that is the specialty. The time duration is divided in the specialty, that is fracture of imaging. So you saw a fracture by imaging, by X-ray, others MRI, then the hematoma imaging. So in that case, if you make the imaging after some time, then you can see some blood on the fracture side, or if you go late at investigation, then a subtle clinical signs may produce, and the clinically obvious, as you can see the features. So now when you see this kind of phenomena, then it is your job, that is component of response time. So you can identify or planning for refer if you have no any adequate management plan or adequate manpower along with the institutional support, then you can advise that patient for refer or the transfer to the tertiary hospital as well as the super specialized hospital. Sometimes may the patient may need anesthesia. Okay, that means pain management. Sometimes you need to make the pain management, that is anesthetization is important, and the decompression, sometimes compartment syndrome and other organ saving methods you must identify or you must choose. In that case, decompression is important, is advised or administered. Now the overall time of external hematoma is death, that means full time. In these two things you can assess or manage the external hematoma. Now the assessment of trauma, that means that you have given the management. So what are the trauma assessment? Okay, that means follow up. So you can see the initial assessment of the trauma patient beside the clinical examination should include the analysis of interaction between the patient, mechanism of injury and extent of injury sustained. That means you must make the initial assessment. Trauma patient beside the clinical examination should include the analysis of interaction between the patient. Now the why the assessment is needed, because include the formation formula mechanism plus patient plus injury. This formula is maintained here. Look for both obvious and less obvious features. I will discuss about that, and they identify more reason when the above formula does not make sense. So sometimes this formula is not maintained, so we have to think the other features, other causes. So more reasons, so identify the more reason other than the obvious or less obvious cause. Okay, now the we will discuss the examples of pattern analysis. That is, first things, formulation mechanism, how the injury occurs. We can imagine the injury or the type of force, the type of accidents we can imagine, and then by which we can assess the specific trauma site. We can identify the trauma site. While you can see there is a flow chart, that is, you can see the mechanism, the left sided impact from road traffic accident, the obvious features. So what is obvious if that kind of injury occurred? Because if the road traffic accident from the left side, there is a definite obvious lateral compression of the pelvis, so it is more common, that is lateral compression. And left sided pneumothorax if there is a chest injury or the rib fracture occurs. So these are the like flexion distraction of flap belt. So if the flexion distraction occurs, then the chance of fracture lumbar spine, dislocated knee, head injury, these are the possibilities may have in different patient. Now electrocution, burn on hand and collapse. That means electrocution is always a deep burn, that is electric burn is a deep burn, and there are some definite resistance points, like these are the joints are the resisting points and the bony prominence. So when the electricity pass through that joints, that in the resistance side, there is a deep burn. So there are some burns and blackening and contracture, non-healing nature, and formation of marginal ulcer as well. So there are many kind of complications regarding the electrocution. Now the dashboard impact. So sometimes patient forcefully impact on the dashboard. In that case, the knee is as a site where on occurs, and if the posteriorly in the hip pressure, in that case pelvic fracture or the head of the femur fracture can be occurs. There is another covert injuries. So sometimes left sided impact has some specific viscera injury like splenic rupture, external hematoma, and the flexion distraction, lap belt can occur, general ruptures, popliteal artery disruption, cervical spine fracture, and the electrocution posterior dislocation of the shoulder and the posterior dislocation of the hip. Okay, so it's the dashboard impact here, where dashboard go through here, so there is a definite fracture or dislocation of the posterior hip. So this is a story of knowing things as it is. So here the sharp object injury, if the sharp object injuries occur, so think about the length and sharp object, that is how length, because as it is a big knife or on an axe or the simple knife or suture, so it depends on how long the sharp object is. Now the knowledge of the local anatomy essential. So where in the region where the penetrating wound or any stab wound occurs, so you have to assess the what kind of viscera and what kind of structures may present in the surrounding to that sharp object. So you must have some anatomical knowledge, and the remember the abdominal stresses as at risk the injury extend the high into the chest. So sometimes you must assess the chest also. Now the firearm injury. Okay, so you can see the firearm injury here. High velocity bullets induce permanent and temporary cavitation. Okay, temporary cavitation can obtain foreign materials, and low velocity bullet induce similar damage to knives. Okay. So these are the points of firearm injuries. So just only for this, no need to elaborate it because it is not needed. So here the other hidden mechanisms or obvious injuries that may present here. So this is the child of various age of anatomic location injury hit by car. So because adult has one kind of car injuries rather than the age 1 child, because it is small in stature and present in the back side of the car, so there is a less chance of injury for him. And in case of adult, he has a good body surface area and can be placed in the front seat and may suffer more in case rather than one age. So there are some other flexibility of trauma, okay, in the different age variation. So here you can see the hidden mechanism that also rise the patient in the unable to give the history of events. So there are some hidden mechanisms, like we can assess the criminal activity. Sometimes some criminals make the homicides and acting or pretended like that it is a road traffic accident. So sometimes a doctor or the forensic specialist must identify that it is a criminal act. So there are some points by which we can identify that it is a criminal activity. Okay. So the raised suspicion. So how can we suspect the victim? That is, external sign of the injury is not consistent with the mechanism. That is, what as the mechanism they said, and must be some similarity or there is some connectivity between this suspicion along with the mechanisms, but there will be a disarrangement in the investigation. Then the long bone fractures in the preambulatory child, because preambulatory child has a long bone fracture. It is an abnormal thing because preambulatory child has a underdeveloped long bone, so there is a little chances of long bone fractures. And inconsistent for changing history, that is inconsistently changing the history, that a victim he is making his own story. So victims can make his own story, and in the different period the story is changed as well as in the individual persons, as in front of the police or in front of the judge, in front of the doctors. So there are different stories of his of trauma, and which reveals that it is a hidden mechanism of criminal act. Now the posterior rib fracture. Posterior rib fracture is so uncommon because lateral and anterior rib fracture is common. So when patient called a posterior rib fracture but the trauma comes from anterior side, it is a wrong concept. Okay. And the aggressive or unusual behavior of the carriers of interview. So in case of interview, the patient become agitated, and sometimes the most of the info or information that he give to the in front investigation officer is lie. Okay. Now what are the hidden mechanism? In short, that is vast majority conscious patient will tell the truth. Conscious patient will tell the truth. The patient involved criminal activity may not tell the truth, that is, it is a lie. And the fear of abuse may prevent vulnerable patient from the telling the truth. In case of trauma, that is rape trauma syndrome, sometimes a patient, a young female patient of rape or rape cases may fear of abuse, may suffer from or think about the fear of abuse, so he is not pretended to give the absolute information that is needed. Sometimes they hide in fear of abuse. Now clinicians have the responsibility to take action when the NIA is suspected. That means you have to inform the police or inform the local security guard, so that you can save the true matters. Sometimes some patient parties will force you to say that you have to accept the wrong things, or that is not happen, but sometimes they forcefully pushed you to make sign or to make a statement regarding the false trauma. But if you suspect this kind of things, then you have to call the police, because it is a police case and you can be suffer, or you can be arrested as a professional misconduct, so it must not be allowed. Okay, now the trauma patient has some assessment. So you must know the assessment, that a knowledge of the timeline important diagnosis, initial management should focus on the what kills first, the severe first, high degree patient before clinical be more apparent, as may be too late to intervene once sign develop. Sometimes you have to choose the which patient you will manage first, because sometimes time is important, that you already know, that is high risk. We must screen the high risk patient first, then manage it, because if the sign symptoms develop, then it is been too late to intervene. And the knowledge of time limit important, initial assessment, and what kills first. So identify the identify the patient which is first encounter, that is what first kills. So response of trauma. Now the important question is how the patient is responding from your management. Okay, so as you can see, this is fully discussion regarding here. There is no important phenomena to understand, because it is story only. So here you can see an important things is a knowledge required the molecular level at immune inflammatory response of injury, concept of phenomena first hit. That is, here you can see the stages of DCO are resuscitation, hemorrhage control, decompression, decontamination, and fractured splinters. So it is sometimes done, that is damage control orthopedics philosophy. So orthopedicians are usually follow this kind of act, that is resuscitation first, hemorrhage control, then decompression, contamination, and fractured splinters. Okay, here the ETS or damage control such as early total care, that is disease hypothermia less than 34, acidosis 7.2, serum lactate more than 5, coagulopathy, blood pressure less than 70, transfusion approaching 15, injury severe courses, score 36, and the early total care criteria: stable hemodynamics, no need for vasoactive or inotropic stimulations, no hypoxemia, no hypercapnia, serum lactate less than 2, normal coagulation, normothermia, more than 1 ml per kg per hour. That is, it seems that it is a minor trauma, or if these kind of sign symptoms or examination features come out, so it is regarded as a severe trauma. So this is a trauma criteria. How can you know that is more severe or less severe? Okay, now here you can see the planning and individual operations. So you must plan. So the stabilization of pelvis and pelvic packaging, it is your ultimate goal. So when a patient is unstable or the stable, if the unstable, then go to the theater and stabilize the pelvis, or if patient is stable, in this case you can go for CT scan, and so assess the arterial brush or not, embolization occurs or not, then these management is done, then the packaging or pelvis stabilization is occurs. So these are the two kind of things, that is, if pelvic fracture occurs, so if it is unstable, go directly through the theater, not only for pelvic fracture but also other different mechanisms of fractures or trauma. That is, if the patient need early surgical intervention, in that case directly go to the hospital operation theater. Okay, or if the patient is stable, then you can have some time for investigations and some medications before any surgery. So these are the trauma response, that rationalize patient management with the development protocols and avoid unnecessary details. Observe, train to identify, promptly involve here. So rationalize, you have to make the patient rationalize and avoid unnecessary delays. So you must not make any delay, and observe trends and identify probably evaluating evolving conditions. And response to mechanism of injury, here what you can see here, that is a be alert to identify frequent pattern of injury. Many stakeholders including the clinicians should engage in injury preventions, and legislations and education are essential because it is the preventive measures. So how you can prevent the trauma, like legislation, education are essential. Sometimes stakeholders, clinicians should engage the injury preventions, that is we must make some social activity of awareness to raising the awareness about the trauma or the most common trauma that occurs in the society right now. Okay, and be alert to identify frequent pattern injuries. So we must have the knowledge that in which trauma, in which which organ is usually affected. So we must make it think first. Now you can see there is two things, that is planning for individual operations and the response of patient factor. So when we will decide the operation needed or not, that is adequate preoperative planning essential, eliminate unnecessary delays and document the plan and ensure no important parameters is left. A whiteboard can be used for demonstrating a water plan and execute the act of communication with this staff. And the response of the patient factor, that is older patient may be vulnerable to injury owing to poor bone stock and other comorbidities. Bone protection treatment is essential. If there is any news of or possibilities of pelvic fracture or any fracture in the elderly patient, in that case it is urgent patient group. And the development of the focal, local and national guidelines to respond to the patient factor is desirable. So sometimes national guidelines and local factors must be maintained by the registered doctors. Now the conclusion, what is the conclusion? So what are the key knowledge that we gathered from this chapter? One is a look for hidden injuries. So you have to identify the hidden injury that is usually seen by our eyes. Remember the time concept. So we must not make delay, because we must have to be hurry, okay, to save the patient. And specific criteria will decide fixation surgery like damage control surgery or the early total care. So if the early total care is needed, then you can manage that person in that way, or if there is any damage control, that in case of directly go to the surgery, and the damage control must be maintained by you. Okay, so that is all we gathered from these chapters. Okay, thank you. So another one is the early assessment and the management of severe trauma. Okay, early assessment, how you can identify the early assessment. So early assessment, there is role of trauma team. So early assessment depends on your team, because if your team is so much active, and then you can manage it as early as possible. So allow the stimulation, so simultaneous and efficient application of ATLS principles, rapidly identify and treat life-threatening pathologies. So first, your team and you must be maintain the ATLS and the identify the life-threatening pathologies. Secondly, they should be led by the most senior clinicians. So there must be senior clinicians, because sometimes juniors cannot take the decision abruptly or quickly. Most seniors from each specialty team should attend the code red trauma calls. So that means some senior clinicians must respond about the juniors red call. So red trauma call is being established. Now the team leader should be trying to consult anticipate the next move. That means team leader, there will be a team leader, that team leader must be a senior one, and he will lead his team. Now the primary survey, you must maintain the three things: C, A, B, C, D, E. Okay, so this is the things of managing a patient. That is, first is exsanguinating external hemorrhage. So if there is any sprouting bleeding or hemorrhage that we see macroscopically, in that case we have to manage that exsanguinary external hemorrhage. Okay, now second is A, B, C, D, E, airway and cervical spine control. So we have to manage that if a patient is airway is patent or not, if there is any external waste product like mud, like water, weeds and other things may be present his airway. In that case we have to wash out that substance and establish airway first, and you have to stabilize this neck and cervical region for spine control. Now the second thing is the breathing and ventilation. So breathing and ventilation is ensured. If the patient is unable to make breathing, in that case artificial ventilation is established. Third thing is circulation and hemorrhage. Okay, so circulation and hemorrhage, that is if there is any chance of hemorrhage, so you must stop the hemorrhage, or and the circulation must be recanalized and re-established. Okay, as well as the large bore cannula and others. If you can throw reading of these books so that you will understand. Now the permission of the hypotension and massive transfusion protocol and tranexamic acid. That means sometimes you may need tranexamic acid to stop the to current bleeding. Okay, and the tranexamic acid used is very good because it is a antifibrinolytic drug that reduces the risk of mortality and bleeding from both blood and penetrating trauma. 1 gram is given intravenously for over 10 minutes, further 1 dose for 8 hours. Okay, because it prevents the prothrombin to thrombin activity in case of common coagulative pathway. In that case the bleeding is stopped. Now the severe hypovolemia, that is tranexamic acid reduce the mortality. All traumatized patient sign shock should receive the tranexamic as soon as possible after injury. So tranexamic is life saving. All trauma care centers should have the established massive transfusion protocol. Severe hypovolemic trauma patients should be resuscitated during the blood and blood pressure. So blood is has no alternative. Blood is the only things that replace the blood. Okay, the only role of crystalloids in initial management of severe hypovolemic patients for the administration of the small quantity maintain blood pressure while waiting for the blood products to arrive. That is, in our country plasma cell or plasma expander is available because sometimes there is we need some time to manage blood. In that case if we wanted to save or the to maintain the hemodynamic stability, in that case we have to take some plasma expander, that is plasma cell solution or other crystalloid solution for hypomelic patient. Now the whole body CT is sometimes been done for identifying the structures. Whole body CT is head to pelvis, IV contrast a gold standard investigation for severity of the injury. Adult blunt trauma patients. So if case of any blunt trauma that we cannot specifically identify where is the trauma occurs, in that case whole body CT is done. It is a gold standard things. So you can see some traumatized patients, some muscle laceration or lacerated injury or severe deglobbing injuries occurs because you can see some joints and bones in the trauma site. It is deglobbing type of injury because there is a muscle loss, huge muscle loss, and there is a huge gap of the wound. Okay, that is called deglobbing injuries. The third is a disability and exposure. So what are the disabilities? So for this GCS score should be calculated and the pupils and assess size, reaction, light, and determine when the moving of the limbs occurs or not. Whole body CT is done for identify the trauma site and intracranial spinal pathology also. Now you can see here is the important things, Glasgow Coma scale, that is you have to make the GCS. There is 3 things: EVM, early best eye response, best verbal response, and best motor response. Okay, so there is scoring system. As they reduce the scoring, there is a severe chances of trauma. There is none, no eye opening, none, no motor response, that is patient is dead. And the eye opening response to pain, incompensable sound, and the extension of the pain, that means the patient is in coma but still he can respond. And the eye opening is speech, he is conscious, opening to speech, inappropriate word slurring, and flexion of the response to pain and withdrawal from pain. So that means the patient is semi-conscious or subconscious. and the eye opening spontaneously oriented or confused, localized pain, novice command. So these are things the patient is conscious and there is a good chances of recovery. So here you can see in short the CABCD treatment. So it is very important for any examination, any viva voce or any written examination. Okay, now there is a secondary survey. We must ensure there is a secondary survey, and the damage control surgery here also. You must early care and versus damage control surgery. So as early as you make the patient manage, the more the chances of good outcome. Okay. Now you can see the venous lactate essential marker for resuscitation. So how the patient is resuscitated or not, because the more lactate means the more laceration, there is a less chances of that is reduced chances of resuscitation. So as less than 2 means early total care, 2 to 3 millimoles, that look at the trend increasing the decreasing, more than 3 means may under resuscitated, should either have resuscitation or damage control surgery, more than 5 means DCS. That is, serum lactate level is an identifying or monitoring parameters that is maintained, because less than 2 means less chance of muscle damage, less chance of tissue injury. In that case, less amount of lactate is produced. In that case, early total care is enough. If 2 to 3, more than 3 or more than 5, in that case we must assess, or that patient must go through the under resuscitation, or if it is not, then damage control surgery is inevitable, must done. Okay, that is all you need for further study, because severe assessment and the early management is important. Okay, thank you very much for patience hearing. But how do you like my channels? If you like my channels, and give a like and subscribe, or give the comment and ask me questions, so that I can give you uneducated answers regarding your question. So thank you very much, and I hope it is started from the trauma. Nowadays I'm trying to cover full trauma, that is basic trauma, but if you have any problems or if you don't understand, keep the comment below, and keep watching my videos. Thank you very much for patience hearing. Thank you. Peace.